My name is Dr. David Pettit. I'm an orthopedic sports medicine and shoulder surgeon here at Adena Orthopedic and Spine Institute. Southern Ohio is home for me. I grew up in Portsmouth, Ohio. My dad was an OBGYN there, my mom was a nurse practitioner, and I really got to see firsthand the difference that they were able to make in people's lives. I did my undergrad, medical school, and residency up in Columbus at Ohio State University. Did a sports medicine fellowship at University Hospitals in Cleveland. I spent the year just doing sports medicine and working with the Cleveland Browns as an assistant team physician. And I always had a calling to come back home. Fortunately, I married a woman from Portsmouth, and her family is still there as well. And so it was really an easy choice. I decided I wanted to be a subspecialist. Adena offered me that type of practice, and we were really fortunate to end up here. The biggest things that we treat arthroscopically are hip labral tears and femoroacetabular impingement. And a good way to think of that is your hip joint is a ball and socket, and you have a round socket, and you have a not perfectly sphere head, and you have extra bone on your femur that when you get up into deep flexion and internal rotation, that extra bone can rub on the labrum, causing labral tears. Hip arthroscopy is a minimally invasive procedure to address intra-articular or pathology inside the joint. It results in decreased pain, increased motion, and can even delay the onset of arthritis. Doing it arthroscopically, it can be an outpatient procedure. You go home the same day. The benefits of hip arthroscopy over a traditional open procedure is it's a much smaller incisions. It's minimally invasive, so that results in a faster recovery, less pain, and we can get people and athletes back to what they love in a matter of 6 to 7.5 months. In the shoulder, I do a comprehensive treatment from arthroscopic procedures and a young high school athlete that dislocates their shoulder up to complex reconstructions and even shoulder replacements. Having these services close to home here in the Southern Ohio region really allows people to be seen in a timely and an efficient manner. So I'm really excited to be a local person and bringing this advanced care to the region. When I was a little kid, my dad and I would go to Ohio State football games, and I just loved the band from a very early age. I auditioned to try out for the marching band as a drum major trainee. You can't be a drum major as a freshman. So I spent 2 years in training, then I was the assistant drum major, and then finally one head drum major. Nothing compares to performing for 105,000 people, and it was a thrill of a lifetime. Whenever I'm not working, I want to hang out with my wife, Sarah. She's my best friend, and we just have so much fun together. We love to be outside, and coming back to Southern Ohio, this is such a beautiful area with tons of outdoor activities. We love to hike, we love to bike ride, we like to go on runs. I love taking care of people. I love getting to know my patients. I'm a talker, so I like to find out why someone is seeing me, what they like to do, and how I can best get them back to doing what they want to do. And that's really why I chose orthopedics. It's really about quality of life and being able to impact a young athlete who wants to get back on the field, or helping a grandma play with her grandchildren without shoulder pain. It's just such a rewarding specialty, and I have the best job in the world.